আমাৰ লগত আজি উপস্থিত আছে ডক্টৰ শ্ৰীনিবাসন পৰমশিৱম তেওঁ হৈছে সিনিয়ৰ কনসালটেন্ট নিউৰোসাৰ্জন আৰু তাৰ লগতে হেড অফ এন্ডোভাস্কুলাৰ নিউৰোসাৰ্জাৰী Apollo Hospitals, Chennai. So first of all, welcome to News 18 Assam Northeast.
नमस्ते.
हम आपसे पहले ही पूछना चाहेंगे क्योंकि आप न्यूरोसर्जरी से बहुत सालों से जुड़े हुए हैं. तो पहले the first question I would like to ask you is what is neurosurgery?
Yeah, when somebody has a neurological problem, there are some problems in neurology that can be treated by surgery. For example, a problem in the brain or spine, for example, a tumor that is growing in the brain or spine cannot be treated with medicines and has to be operated. That is what we call it as neurosurgery. In neurosurgery realm, we treat a lot of diseases, starting from the brain to the spine. For example, a growth within the brain is called a tumor, or growth in the surroundings of the brain is also called benign tumors, and the ones which are causing fluid collection in the brain are common problems we treat. Apart from this, we also treat a wide variety of somebody suffering with trauma to the brain or spine, like the head injury, spine injury, and then people suffering from spondylotic diseases, degenerative diseases of the spinal cord also we treat, and we also treat a wide variety of abnormal vascular malformations in brain and spine. So all this together constitute neurosurgery.
Okay, along with that, अगर हम आपसे पूछना चाहे कि कौन से एज के पेशेंट्स हो सकते हैं, like what group of patients do we have? When we talk about neurosurgery, हम देखते हैं कि बच्चों से शुरू करके बहुत उम्र तक न्यूरोसर्जरी का इश्यूज रहते हैं लोगों में. So what age group can we say?
Yeah, we treat patients of all age group. The diseases in different ages are different. For example, a newborn baby born with certain problems in the brain, for example, an abnormal vascular connections, or some children born with a congenital abnormality, like you might have heard of meningomyelocele, a swelling at the back of the spine that can also cause problems in children. Sometimes children with tumors in the brain we treat. As they get older, the problems are a little bit different.
Okay.
The younger age group can present with benign brain tumors or malignant brain tumors. People in the middle age can develop with aneurysms, or different set of high malignant brain tumors can happen. And older age group can present with features like normal pressure hydrocephalus. They present with difficulty in walking, they present with difficulty in controlling urine, and we also treat very old age patients who present with stroke, that is acute ischemic stroke or bleeding within the brain. So we treat a wide variety of age group, right from newborn babies to very, very old age.
Okay, if I ask you what are the complexities, like with what age, ऐसा है क्या कि जो छोटे उम्र में जिनको न्यूरो सर्जरी या न्यूरो प्रॉब्लम्स होते हैं, they can have the more percentage of recovery than the people who are more in age, like वैसा
correct, absolutely like correct that? Yes, usually children recover very, very well. In spite of extensive lesions in the brain after we operate, because the brain is still growing, especially in children less than 5 years of age. They have a lot of neuronal plasticity and the neural growth is still happening and the myelination is still happening. They recover much, much faster and better than somebody who is more than 60 years old. Okay. See, we are all born with certain amount of neurons. We are born with about 2 billion neurons. But as we grow older, the number of neurons start shrinking. And the number of neurons gets reduced.
Okay.
The recovery is much faster in a younger individual than an older individual. For example, you take somebody having a head injury. The head injury in an 18-year-old will have a much better recovery than in a 60-year-old. So the recovery is good and better in younger age group than older age group.
Okay, along with that, because we are talking about the age groups, I have been told to ask, like a lot of people have this issue of toe walking, particularly in children. It's seen that toe walking or difficulties in walking. For children also, such kind of issues are seen. In Assam also, we have a lot of patients. We'll talk about Apollo Chennai, but definitely, because you are from there and you come here every 2 months to, we can say, consult with the patients here. We'll talk about Apollo Chennai, its specialties and everything. But before that, because we are talking about toe walking and it's a major issue in Assam, so थोड़ा उसके बारे में आप बता दीजिए.
Yeah. Well, let's talk about the difficulty in walking. This is one of the common symptoms both in children as well as in old age. Children, as the child grows, as the child reaches 1 year of age, the child should be able to stand and start walking. If the child has difficulty in walking, it could be due to various reasons. A problem in the brain can cause difficulty in walking, especially the problems in the small brain. We have the big brain, we have the small brain.
Okay.
The small brain is associated with balance and control mechanism. If the balance is lost, the child will have wobbly walking. If there is a problem in the spinal cord, again the child can have spastic walking, that is what you called as a toe walking, or like have difficulty in maintaining the balance, and there will be a lot of stiffness, tightness in the legs that can potentially happen. Or the child may have problems with the peripheral nerve, or the child may have problems with the muscles and the tendon, which is controlling. So for a child or somebody to walk, the control of the nerve, spinal cord, the peripheral nerve and the muscles have to be intact. The problem can be anywhere.
Okay.
Our role is we pick up where the problem is and do a targeted treatment so that the child can get back to normal walking.
Okay. So with children with this issue of toe walking or difficulties of walking, what are the chances of getting it treated? Like how major can we consider it? Like if we talk about this problem in neuro problems, neuro issues.
Yes, in general we'll have to examine and do appropriate evaluation. For example, we may do a scanning of the brain and spinal cord, or we may do a nerve conduction test to look at the nerves, or we look at the muscles, we do a different set of testing, and then find out where exactly the problem is. And based on the problem, the treatment varies. And the recovery depends on the severity of the problem. The earlier we find, the better chance of recovery. A good number of them, like after we treat them acutely for the problem, they will have to undergo a phase of rehabilitation. Rehabilitation is physiotherapy and routine exercises to make sure that their gait gets back to normal range.
Okay. Along with that, because we are talking to you, and you particularly are heading the neuro department in Apollo Chennai. So I'll have to ask you about how different is Apollo Chennai from the other hospitals for neurosurgery, because we have seen there are a lot of patients even from Assam go to Apollo Chennai for better treatment. Why is it very known for it, and what different is it about the neuro department in Apollo Chennai?
Yeah, the neurosurgery department in Apollo Hospitals Chennai is one of the best departments in the country because we offer a wide range of treatment with advanced technology. Today, we do surgeries in brain and spine with extreme precision. Pre-operatively, we evaluate them with advanced imaging techniques like MRI, MR spectroscopy, we do functional MRI, we do diffusion weighted MRI to understand the tracks. For example, if there is a tumor, we understand all about where the functions are splayed, we understand how the fiber tracks in the brain are splayed and how we have to exactly approach. So we do a lot of pre-operative planning in our mind, and after the planning, during execution, we have the advanced technology. We have the high-end microscope. We do intra-operative neuronavigation. We also do awake craniotomy. We also do intra-operative fluorescence. We have intra-operative ultrasound, and we have intra-operative neuromonitoring. That is, we constantly check the functions of the nerve even when the patient is under anesthesia, and we operate. With all this technology put together and with a good post-operative recovery, like a specialized neuro intensive care unit, we offer the best treatment and we give best results, and the patients recover much faster. Apart from that, in selected cases, we also do minimally invasive surgeries like endovascular surgeries and endoscopic surgeries, and this holistically puts Apollo Chennai at the top of the line, offering neuro care for the patients, and that's why patients come to us for advanced treatment.
Of course, and with the term of endovascular neurosurgery, I would also like to understand particularly what is endovascular neurosurgery. Like if we have a lot of ideas between us, but most of the time when it's about neurosurgery, people get confused about the terms. So
Correct.
what is endovascular neurosurgery? What comes under it?
Yeah, endovascular neurosurgery is operating from within the blood vessels of the brain.
Okay.
Let me just explain to you very simply. In the heart, in the past, they always did an open heart surgery. But today, they go endovascular and do a lot of stenting, balloon angioplasty, you might have heard of. Likewise, in the brain, when there is a vascular problem, for example, a bulge in the blood vessel, commonly we call it as aneurysm, we don't need to open the skull, do microsurgery anymore. We go inside the blood vessel with the X-ray control, we inject dye to check where the bubble is, and then we go inside the blood vessel with small little micro catheters and micro wires. We place coils inside the aneurysm and coil them and seclude them from the circulation. Likewise, high flow vascular malformations like AVMs, AV fistulas, we treat endovascularly in children as well as in old age. And today we do a lot of acute stroke. Somebody who comes with a stroke and the blood vessel is blocked, we go inside the blood vessel, release the block, open up the blood vessel, and all this constitute an endovascular neurosurgery.
আমি আৰু কথা পাতি যাম, কিন্তু এইখিনিতে সময় হৈছে এটি সমূহ বাণিজ্যিক বিৰতিৰ।
মর্মিতা মিত্র।
एसएमएस गाने का इम्पैक्ट मेरे लाइफ में बहुत ज्यादा है। एसएमएस का कुछ मतलब बहुत মৰম লগা ভাষা।
মৰমেৰে কৈছে। অসমীয়া ক'বলৈ মৰ্মিতাই শিকিছে নে নাই? এইটো কিন্তু মই অসমীয়াতে সুধিছো।
মই শিকিবলৈ চেষ্টা কৰি আছো। अपना गाना एसएमएस गाना ही होगा मेरा लाइफ में पहली बार। ये बहुत मतलब खुशी की बात है मेरे लिए। एक्चुअली पापोंदा का गाना गाने में अलग सा मजा लगता है। मजा इसलिए आता है कि पापोंदा का एक एक गाना एक एक टाइप का होता है। बिहू गाना कुछ अलग सा है, सुनने भी अच्छा लगता है, गाते में भी बहुत मुझे अच्छा लगता है।
দেওবাৰে সন্ধিয়া 7:50
বিৰতিৰ পিছত স্বাগতম জনাইছো। আপোনালোকে চাই আছে নিউজ 18 বিশেষ। আজি আমাৰ সৈতে এগৰাকী বিশেষ অতিথি আছে। আমাৰ সৈতে আছে ডক্টৰ श्रीनिवासन परमशिवम। हम आपसे बात कर रहे थे न्यूरोसर्जरी के बारे में। सो टॉकिंग अबाउट स्ट्रोक, আমাৰ দৰ্শকসকলে ইতিমধ্যে দেখিছে বিভিন্ন সময়ত এনেকুৱা বাতৰি আমি সম্প্ৰচাৰ কৰিবলগীয়া হয় যে বিভিন্নজনে ষ্ট্ৰোকত ভুগি মৃত্যুবৰণ কৰিবলগীয়া হয় আৰু খুব বেছিকৈ বাঢ়িবলৈ ধৰিছে ষ্ট্ৰোকৰ যিসমূহ ষ্ট্ৰোকৰ পৰা ষ্ট্ৰোক হৈ যেনে ধৰণৰ বিঘ্নিত মানুহৰ জীৱন হয় তেনে ধৰণৰ কিছু ঘটনা অলপতে বেছিকৈ হ'বলৈ ধৰিছে। সো টকিং अबाउट ষ্ট্ৰোক ট্ৰিটমেন্ট, what are the advancements that has taken place in the recent times regarding stroke treatment? How can we treat a stroke?
Yeah. In today's world, we treat strokes so differently from what we have done in the past. In the last 20 years, if somebody has a ischemic stroke, which is the most common type of stroke. See, in general, strokes are of two types. One is a ischemic stroke where the blood vessels are blocked. Other is a hemorrhagic stroke where there is a bleeding. If the ischemic stroke happens, blood vessels are blocked, we treat them by endovascular treatment. That is, we go inside the blood vessel, we remove the block, allow the blood to flow, and the patient recovers so well in a very quick time.
Okay.
Somebody may have a carotid narrowing. They have a narrowing of the blood vessels in the neck or inside the brain, and they will have constant low flow to the brain. that will reduce their functional level. That will reduce their brain function level, like memory disturbance. They will have difficulty in walking, difficulty in moving the hands or legs, and they may have transient symptoms. Sometimes the symptoms would come and then get relieved. These patients are the ones where we need to open up these vessels.
I wanted to ask you that even if the stroke gets treated, but sometimes we see that people get disabled, like they have a part not working anymore after they have had a stroke. So what kind of treatment can endovascular neurosurgery help such kind of things?
Yeah, there are different types of strokes based on the evolution. For example, if the stroke happens acutely in minutes and the vessel is blocked, they need an urgent treatment.
Yes.
And that needs to be done in a timely manner, because the brain does not survive if there is no blood supply for a very, very short time. So we need to treat it acutely. There are some strokes which happen over a period of time with the low flow, as I explained, that can be treated more electively. So when we treat on time, not allowing the brain cells to die, then they recover completely. If some part of the brain has already been damaged by the stroke and it is permanently damaged, then they end up with significant disability, hand, leg weakness, and we can only make them better with the rehabilitative process and helping them with regular physiotherapy.
So you were saying like the instant strokes happen that we get to see, they need instant treatment. Sometimes it is happening in a period of time, like slowly the stroke is hitting. How do a person know that he is getting hit by the stroke, he is having a stroke problem?
Yes, the stroke is a very, very important disease that every common man should know the symptoms. Okay, we call it as BEFAST, be fast. So be fast for stroke, right? So B is for balance. Anybody who loses the balance have to take medical advice. E for vision, difficulty in seeing, they have to check the doctor immediately. F for face, if they have, when they smile, if they have a facial deviation, you ask them to smile. If they have a facial deviation to one side, that's a sign of stroke. A for arm, you ask them to lift both their arms, and if one of the arm is, say, drifting, if the arm is drifting, then they will have to reach out to the doctor. S stands for speech. If they have a difficulty in speaking, you talk to them, they cannot understand. You talk to them, they are not able to reply you back. That again stands for sign of stroke. The speech is a sign of stroke. And T for time. Time is the essence. They will have to reach out immediately. So if somebody is doing a regular checkup, then they have a very good chance of preventing a stroke. About 80% of the strokes are preventable. How do we prevent a stroke? Like you prevent a heart disease, you can prevent a stroke. For example, you do a regular checkup, control your blood pressure, control your diabetes, control your high cholesterol or dyslipidemia, and then you do a regular checkup of the carotid to see if there are any blocks. There is good 80% of the strokes can still be prevented. So you need to do a regular periodic checkup if you're above 40 and make sure that your stroke is prevented. That's the best way to treat stroke.
দৰ্শকসকলক সেই কথাটোৱে বুজাব বিচৰা হৈছে যে যেনে ধৰণে হঠাতে কিছু ষ্ট্ৰোক মানুহে ভুগিবলগীয়া হয়, ষ্ট্ৰোক হয় আৰু তেনেকৈ কিছু অসুবিধাত পৰিবলগীয়া হয়, তেনেকৈ কিছু ষ্ট্ৰোক কিন্তু দীঘলীয়া সময় ধৰি আমাৰ হৈ থাকিব পাৰে আৰু হেয়া আমি তেতিয়াহে গম পাম যদিহে আমি সময়মতে চিকিৎসকৰ ওচৰলৈ যাওঁ। আৰু 40ৰ ওপৰৰ যিসকল লোক তেওঁলোকে ৰেগুলাৰ চেকআপ যদি কৰি থাকে তেনেহলে এই দীঘলীয়া সময় ধৰি যে ষ্ট্ৰোক এটা আমাৰ হৈ আছে সেই কথাটো আমি গম পাই উপযুক্ত সময়ত তাৰ চিকিৎসা কৰিলে সেই ষ্ট্ৰোকৰ পৰা আমি হাৰি থাকিব পাৰো, ষ্ট্ৰোকৰ পৰা আমি বাচি থাকিব পাৰো। হেতু এটা খুব ডাঙৰ কথা তেওঁখতে ক'লে বি ফাষ্ট, মানে বিভিন্ন ধৰণৰ আসলতে সিম্পটম আমাৰ মাজত দেখা দিয়ে। হেয়া চকুৰ দৃষ্টিশক্তি হ'ব পাৰে, হেয়া তাৰ হাতখন ডাঙুতে আপোনালোকৰ কেনে ধৰণৰ অসুবিধা হৈছে তাকলৈ হ'ব পাৰে, বিভিন্ন কথা তেওঁ ইতিমধ্যে বুজাইছে। কিন্তু ষ্ট্ৰোকটো যে আমি আসলতে নিজেই চিকিৎসা কৰিব পাৰো, দীঘলীয়া সময় লাহে লাহে হোৱা ষ্ট্ৰোকটো, সেই কথা তেখেতে বুজাই গৈছে। So along with that, we were talking about stroke rehabilitation. Stroke rehabilitation, has it become more advanced in the recent times? How advanced have we come this far, like Apollo particularly?
Yes, today if somebody is having a stroke and if they are left with disability, we acutely treat them, make sure that they could make a good functional recovery. But in spite of that, there are some patients who will have some amount of disability. But putting them back on the society with good functional recovery is the goal. So the first 3 to 6 months acute rehabilitation is very, very, very important, and we make an emphasis that they do the physiotherapy regularly, and we have advanced techniques of physiotherapy like the robotic physiotherapy, and then we take them through the neurostimulation modules where we stimulate the nerves, we stimulate the muscle fibers so that they make a good functional recovery. And there is also a lot of modules based on artificial intelligence driven rehabilitation process which are coming up in the recent times and which are getting advanced as we speak, and we use all those technologies to make them better. And there is so much of advancements have happened in the rehabilitation, and in the near future it's going to only increase, and the patients will benefit out of these kind of advancements.
Rehabilitation is by far the most important part as well, right? Because after getting treated, to rehabilitate the patient is properly rehabilitate the patient is very important.
Absolutely. Treatment is one part of the overall management of the patient. The most important thing is the patient has to cope up and get back to the normal society and get back to doing the routine things that the patient used to do in life. To get them back to that functional level, rehabilitation is a very, very important step, and that should not be skipped even after they return back. For example, if I operate a patient in Chennai and they come back to Assam or Guwahati for further management, we advise them on what kind of rehabilitation needs to be done and what kind of physiotherapy and exercise needs to be done so that they can slowly and progressively get back to their normal routine functional life.
Okay, and along with that, I have been also told about an issue called carpal tunnel. I personally also have been suffering from carpal tunnel since a long time now. So somehow it has become a part of my life. So most people feel some kind of a pain on the palms. মানে হাতৰ তলুৱাত কৰবাত এটা বিষ অনুভৱ কৰে সাকে বিভিন্ন জনে কৰে বিভিন্ন সময়ত আপত্তি তেনেকুৱা আমি দেখিছো যে এনেকুৱা ধৰণৰ সমস্যাত ভুগা কথা তেওঁলোকে কয় যত এই নাৰ্ভৰ কিছু সমস্যা দেখা দিয়ে. So the nerves here somehow it pains a lot. Which part pains, it's very difficult to say, but both for the both palms, right and left, severe pain is being felt on the palms. So is it carpal tunnel, or how do we check it? What are the treatment for carpal tunnel? Can it be cured by an operation?
Yeah, there are various types of compression syndromes in the nerve, and carpal tunnel falls under one of those compression syndromes. Compression in a sense, as the nerve comes from the spinal cord to the peripheral structures like controlling the muscles, it gets compressed when it goes very close to a nerve or in a compartment. Carpal tunnel especially is a tunnel in the hand at the base of the hand wherein there is compression of the nerve here. And when there is a compression, especially when you're doing certain work, like in women when they are cooking, or when they are writing, when they are typing, they tend to get a lot of pain in the hand, and they get relief by shaking the hand. Especially in the night when they are sleeping, they may wake up from the middle of the night with the pain in the hand. They may have to shake the hand to get some relief. That classically tells it's possibly a carpal tunnel. If somebody suffers from that, they need to meet a neurospecialist, and the first thing we do is we check their nerve conduction test. And then we check if there is a compression of the nerve, which is shown very well in the nerve conduction test. One. Second thing is a good number of them may also have associated thyroid problems. When there is a thyroid problem, especially hypothyroidism, they may have swelling of the soft tissue compressing the nerves. So the first treatment will be targeted towards controlling the thyroid function, one. Second thing is we manage them medically. Without surgery, we try to manage them with change of position, change of techniques to handle things in a day-to-day life. If they are not relieved by these measures, then comes the surgical technique, where with a simple, very small incision, we can release the nerve, and it's a day care procedure. With that, they can have complete relief for the rest of the life.
So it will be first treated to know if it needs a surgery, and after that it will be done, right? Like just because someone is having a pain not necessarily means that it will be carpal tunnel. Is it like that?
Correct. There are other causes of pain in the hand. For example, a compression of the nerve in the spinal cord can cause pain in the hand. Compression of the nerve in the elbow can cause a pain in the hand. If the compression of the nerve is in the wrist, can cause pain in the hand. So we will evaluate very precisely on where the compression is, and we manage them based on the severity of the symptoms by various methods, and surgery is just one of the methods.
Okay, along with that, because you visit from Apollo Chennai to Apollo Guwahati in every 2 months, proti 2 mahor mure mure Apollo Guwahati loi ahe aru bibhinno jonor hoite teoloke kotha pate kenekon dhornor samosyar sammukhin hoise ki koribo pora jay bibhinno dhornor consultancy teoloke korai aru heya hoy আপোনালোকৰ Apollo Information Center ত যোগাযোগ কৰিব লাগিব তাৰ পিছত তেওঁৰ হৈতে যোগাযোগ কৰিব পৰা হ'ব তেওঁলোকে জনাব তাৰ পিছত সমস্যা সমূহৰ কথা বিতংভাৱে ক'ব পাৰিব so my last question to you will be what are the we can say what are the kinds of problems the common nerve problems neuro problems that you have seen in Guwahati in the people in Assam because you have been visiting Apollo Guwahati for quite some time now in every 2 months so what are the traits that you have seen
Yeah, the neuro problems are quite common across the globe, and most patients have a similar pattern of symptoms. The most important thing that the patient feels is the symptoms. The common ones are chronic headaches. Headaches are a common symptoms. The second most common symptom is vertigo. They may have a dizziness, spinning of the head is also a common symptom. Other focal neurologic deficit like vision disturbance or hearing disturbance, difficulty in swallowing, facial deviation, and all those symptoms related to the brain can happen. The common ones are the headaches and dizziness are the most common ones. Apart from that, people having spinal disorders like they may have neck pain, back pain, difficulty in walking. These are the most common symptoms that I see with patients in Guwahati when I come for camps at the Apollo Information Center.
And how we can say the more early they come for the treatment the more chances of getting it cured is it like that because
absolutely any neuro problem at the slightest of symptoms you should meet the specialist, get it evaluated, make a diagnosis and treat it properly. The earlier it is treated, the chances of recovery are much higher. So early treatment is the essence of recovery in neuro problems. Once the nerves are damaged, it's very hard to bring them back. So early and preventive treatment are the best way to cure neuro problems.
Thank you so much
It's my pleasure. Thank you.
Dr Srinivasan Paramsivam তেওঁ হৈছে সিনিয়ৰ কনসালটেন্ট নিউৰোসাৰ্জন আৰু লগতে হেড অফ এন্ডোভাস্কুলাৰ নিউৰোসাৰ্জাৰী এপোলো হস্পিটেলছ চেন্নাই তেওঁৰ সৈতে আমি আজি বিভিন্ন কথা পাতিলো নিউজ 18 বিশেষ অনুষ্ঠানটিত কিছু কথা পাতিলো নাৰ্ভ নিউৰোসাৰ্জাৰী সৈতে জড়িত আৰু আপোনালোকে যদি তেখেতৰ সৈতে কথা পাতিব বিচাৰে তেনেহলে প্ৰতি দুমাহে তেওঁ গুৱাহাটীৰ এপোলো হস্পিটেলত উপলব্ধ থাকে গতিকে তেওঁলোকৰ সৈতে যোগাযোগ কৰিলে তেখেতৰ সৈতে বিভিন্ন কথা বিভিন্ন সমস্যাৰ কথা পাতিব পাৰিব আজিৰ অনুষ্ঠান চাই থকাৰ বাবে ধন্যবাদ নমস্কাৰ